In this video, we will discuss about hemophilia. It is basically coagulation disorder because bleeding time is fine but coagulation time is affected. It is also called as sex or X-linked recessive or autosomal disorder. This one is the hereditary disease. Parent passing to over the child. It is also called as royal disease because the Queen Victoria of England acts as a carrier. So it is also called as coagulation disorder. Other name royal disease, X-linked recessive or autosomal disorder. This one is the hereditary disease. Parent passing to over the child. This one is cell having nucleus having chromosome, 23 pair of chromosome. This 22 considered as autosome, 1 considered as allosome. This one is also called as sex chromosome, otherwise called sex chromosome. Here, any defect is there means or disease causing gene presented means it transmit to another generation, transmitted to the next generation. It is called as sex linked inheritance. It have two types. Allosome having two types of gene, X and XY. In the case of female, XX. In the case of male, XY. So X defective means that X gene have any defective means it considered as X chromosome related disease. So X linked inheritance. Y chromosome having any disorder or defective means it is called as Y linked inheritance. This one is not common. This Y linked one is not most common. X-linked inheritance. So, what are the other diseases it will causes? Red-green color blindness, or it is also called as daltonism. That means they cannot identify clearly in red or green color. So, first example disease red-green color blindness, also called daltonism. Second one is hemophilia. Hemophilia, the thromboplastin. This substance not produced means not occur in blood clot. The thromboplastin gene have any defect means it causes hemophilia. So example of X-linked chromosome disorders, red-green color blindness, also called as daltonism, and hemophilia. This thromboplastin presented in X chromosome. That's why it is called as X-linked inheritance. Next one is introduction part. This hemophilia is have another name, bleeder's disease. This one caused by recessive X-linked gene. This was first isolated John Cotto in the year of 1803. So here lacks of normal clotting substances, absence of normal clotting substances, that thromboplastin response for this one clotting. So here not produced means it will causes hemophilia. So lack of normal clotting substances, that thromboplastin not produced means it will causes hemophilia. So introduction part, it also called as bleeder disease. John Cotto in the year of 1803 first isolated. Then here absence of or lack of normal clotting substance, that thromboplastin absence, so it causes hemophilia. Next, how it will occur. Minor injuries also causes continuous bleeding and leading to death. So all blood comes out, so it causes death. Female are carriers, more in male. Male only affected, female act as a carrier. Minor injuries also continuous bleeding, finally it causes death. How it will transmit one generation to another? By that method name is called as Criss-cross method. What is Criss-cross method? Male and female cross sex determination. Here male XY, female X dash X, because here female affected means, in the case of female affected means here X dash and X. So next generation X normal X, this son without hemophilia. Second one is this X, here this carrier infected female, so X dash and X, daughter carrier for hemophilia. But here this S is predominant one, dominant one, so here this daughter act as a carrier. Okay, because not producing disease, here this X is dominant one. Next one is from here Y, from here X dash, this son. So here X dash and Y, here X dash expressed. So he got disease, son affected from hemophilia. Next one is Y X without hemophilia. This daughter not getting hemophilia. This son and this daughter normal. This daughter carrier. Here this Y here suppress. Okay. So here express, here this X dash is express. So it causes diseases hemophilia. In the case of male affected means carrier father, normal mother. So next generation daughters carrier, normal son. Okay, son's not affected. So in this case of male affected means female act as a carrier, female carrier means male affected. So this phenomenon name is called as Criss-cross phenomenon. So here S, X and XY not transmitted next generation. This X dash X daughter carrier only transmit to next generation. This Y X dash son confirm transmit to the next generation. He affected from that hemophilia disease. So what is the reason? Thromboplastin inducing factor absent here. Gene factor 8 is at X chromosome. All protein are controlled by gene. So factor 8 responsible gene presented in X chromosome. That gene is absent. So factor 8 not synthesis thromboplastin. So blood clot absent in that patient. Absence of factor 8 response hemophilia. Next, clinical features. For more minor drama, the person have more bleeding. So bleeding in soft tissue, muscles, joint, gastrointestinal and urinary tract, and from nose. Next, the joint hemorrhage, joint damage. So all places bleeding. There can be intracranial hemorrhage, dangerous than hemorrhage in floor of mouth, cause respiratory obstruction, and It also causes suffocation. Next, what we will check diagnosis for hemophilia. Here, bleeding time is normal. Platelet count also normal. Prothrombin time also normal. But that coagulation time is more. Coagulation conversion of fibrinogen to fibrin, that is coagulation, and partial prothrombin plastine time is more. Here factor 8 less or not powerful. So diagnosis method, bleeding time, platelet time, prothrombin time, all the things normal, only coagulation time is more because of less amount of clotting factor 8. Next, coming to etiology. Why does it happen? Because of hereditary disorder. Otherwise, another reason, mutation. If mother carrier means 50% sons affected because of Criss method. If father affected means all daughters act as a carrier. We already know because of hereditary, otherwise mutation. A gene coding for clotting factor 8, that one less than 5% or reduced activity causes hemophilia. When it comes to hemophilia, factor 8 is affected. Most of the cases, factor 8 less means hemophilia. Some cases, factor 9 and 11 less means hemophilia. Bleeding time by Tooke's method 1 to 5 minutes. Then clotting times by capillary tube method 2 to 8 minutes. Basically, the clotting time will be prolonged because factor 8 less. Queen Victoria of England, she had a carrier from royal family, so it had that name, royal disease, we already known. Factor 8 less than 5% or reduced activity. Actually, that factor 8 synthesized in liver. It is circular with BWF, von Willebrand factors. Here this factor less means it is autosomal dominant. Both bleeding and clotting time is more. So here reduced activity or factor 8 actually synthesis from liver. It circulate with von Willebrand factors. This one is less means it will causes hemophilia. Next, types of hemophilia. It have three types, A, B, C. Type A hemophilia, it is a true classical hemophilia and very common. It is a deficiency of clotting factor 8. It is nothing but anti-hemophilic globulin. It is a X-linked recessive disorder. Second one is type B hemophilia. It is similar to type A but deficiency of factor 9. This one nothing but Christmas factor due to family of Christmas. Next one is factor, this one it is a plasma thromboplastic component. This one also X linked. Last one is type C, deficiency of factor 11. Factor 11 plasma thromboplastin addisonant. But this one is the dominant variety, that means more dangerous one, and comparing to other, this one is the more dangerous one. Next, move to treatment. Clotting factor 8 replacement. Next, preventive method, prevent consanguineous marriage. So we will give marriage counseling. Consanguineous marriage. So now we will see that statement form. Hemophilia, coagulation disorder, royal disease, hereditary disease, X-linked inheritance, Daltonism, hemophilia. Minor injury also continuous bleeding. So it is transmitted one generation to another. Male affected means it will causes infection in female. Female affected means causes infection in male. Male affected means female only carrier. Okay. Female means male easily affected. So Criss phenomenon. Bleeding, full bleeding. Then diagnosis method, bleeding, platelet counting, prothrombin, all the things normal, only clotting factor only less, so coagulation time is more. Three types A, B, C. A means type 8, B means type 9, C means 11. So treatment clotting factor 8 replacement, then consanguineous marriage marriage counseling. This is all about hemophilia. Thanks for watching.